This video is a guide for you and your child to learn exactly what happens when you're referred for a video fluoroscopy swallow study or VFSS at Perth Children's Hospital. Medical procedures can be a bit overwhelming, especially for the youngest members of our community.
You're doing really well.
We're hoping this video is informative and reassuring for both you and your child. Your child's speech pathologists have recommended a video fluoroscopy swallow study to gain valuable insights into your child's swallowing ability. Think of the VFSS as a special moving X-ray that provides a detailed look at your child's mouth and throat dynamics while they enjoy their favourite food and drinks. This incredible tool enables the team to observe how food and liquids move from your child's mouth to their tummy, giving the team a really clear understanding of their swallowing process.
We've got the lunchbox that Dad's prepared for you. Does it smell good? Yeah?
Importantly, the detailed study, or VFSS, helps the team of experts at PCH ensure the safety of your child's lungs. It can determine if your child can effectively protect their lungs during the swallowing process. A few days before your child's study, a speech pathologist from PCH will phone and talk to you about what to expect on the day. They'll ask questions about your child and their referral. It's also a good opportunity to ask the speech pathologist any questions you may have. On the day of your appointment, when you arrive at PCH main entrance, turn right and head down to medical imaging. It's just before the emergency department. Let the team at the desk know when you arrive.
We're here for a video fluoroscopy.
Wonderful. Can I get the date of birth and surname, please?
You can bring a favourite toy or book for your child to play with while you're waiting. And you should bring a bottle, cup, spoon or bowl your child normally uses. It's important that your child is ready to eat and drink, so please don't feed them for the few hours before you arrive. A staff member will meet you in the waiting room.
Hi, Ali and Julie. Hi, nice to meet you. My name's Caitlin. Have you brought some lunch with you today? Yeah? Thank you. I'll go get this ready and then I'll come back out. See you soon.
The speech pathologist takes the food and drink to mix in powder or liquid. This makes sure that the team can clearly see it on the X-ray. It might change the look and taste of the food just a little bit. The speech pathologist will prepare a number of different drinks and foods with different textures or fluids. This makes sure they check thoroughly for all different methods of swallowing. Once they are ready for you, a staff member will bring you and your child down to the X-ray room. But please be aware if there are any emergency appointments, these children may have to go in before you and your child.
Hey, Ali, do you want to come and sit in our special chair? Mummy will help you get in.
When you arrive, one of the team will make sure you're safely dressed in a lead apron, and it's really important to let the team know if there is any chance you could be pregnant. Each child's study might look a little bit different. A child's age and regular feeding position are some of the things that may vary how they perform the study.
The machine makes a little bit of a noise when it moves, okay? Awesome. Now the camera's in the best position.
The machine moves up and down and makes some noise while the doctor gets it in position, so the team gets a really clear view of the swallowing action.
All right, there we go, Mum. We're ready to start.
The speech pathologist or nurse assisting will be beside you for the entire study and walk you through every step of feeding and comforting your child. It's routine for the team viewing the X-ray to stop, start and change positions during the study.
Julie will finish up there. We'll try something different now, thank you.
It's really important for your child to stay in position, so the X-ray is really clear. Going to the hospital can worry some children, so making them as happy and calm as possible is important. The team are very skilled in making sure this experience is really easy. Bubbles, books or toys are always an easy distraction for young kids.
We say hi.
You can even let the team know their favourite song and they can play it on the speaker.
Baby shark, do 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 do, baby shark.
The study will take about 30 minutes. Once the study is finished, you can go straight home. Just follow the pink triangles on your way out. We will let you know about any changes to your child's eating and drinking plan during the scheduled feedback session. There are a lot of people involved in your study, so if you aren't able to attend your VFSS appointment, it's really important that you let them know as soon as possible. We hope this video has given you a really good understanding of what to expect for a video fluoroscopy study and, most importantly, makes the experience easier for you and your child.